If you're applying for a Band 6 Trauma and Orthopedics Physiotherapy role and you're revising your textbook answers, stop right now. Having experience of being on both sides of the interview desk, today I'm going to tell you what panelists are actually looking for, along with what separates an average candidate from an appointable one and what answers get you selected. My name is Kuratulen and I've worked as a physio in the NHS and as a first contact practitioner in one of the biggest GP partnerships in London. And welcome back to Physique, the channel where we help physios achieve their career goals. A Band 6 TNO is not about knowing everything. It's about proving that you're safe, structured, reflective, and ready. Now, before we jump into the questions of the interview, there are two really important things that you need to know. First is a mindset shift. For a Band 6 role, the panelist is assessing for these 5 things that are going to separate you from a Band 5 role. Number 1 is your clinical reasoning and not your memorized protocols. Number 2, your prioritization and risk assessment of complex cases. Thirdly, your ability to work independently but escalate appropriately. Number 4 is your communication with the multidisciplinary team, the patients, and their caretakers. And last but not the least, number 5 is your insight into limitations and governance. Remember these points for your Band 6 interview, because if you keep answering like a Band 5, you won't get appointed even if you're clinically sound. Number 2, whenever you're asked a question in the interview, take your time. It is completely normal to take a pen and paper with you to the interview and communicate with the panel that you're going to take a few moments to reflect on the question and then answer. And you can always make like some small points of the questions asked and put down some bullet answers before you start replying. Remember that you have to respond to the question with your best clinical knowledge and reasoning and not react without even thinking. Without further ado, let's start with your behavioral or values-based questions. Number 1, tell us about a time you managed a difficult patient or a challenging situation. When answering a question like this, it is advisable to include a clinical scenario, because that will not only show how you deal with a challenging situation, but also will reflect your clinical knowledge. And a good answer is going to include a person-centered care approach, communication or working within a multidisciplinary team, your reflections of the case, and ensuring that you work with a safety-first approach. For example, you can talk about a scenario of an elderly patient post neck or femur fracture who was medically stable but was refusing to mobilize because of the fear of pain or falling. Now, one thing I want to mention here, that if you are explaining or in a question where a patient is involved, always communicate that you are first going to introduce yourself to the patient, and then also make sure that you are with the right patient by confirming the identity of the patient. And if the answer involves doing any examination of any sort, then you will include that you're going to sanitize before and after, as well as take consent before touching the patient. And then you can start with the importance of communicating, and then you can continue with the importance of communication, how you spoke to the patient, explored their fears and validated their concerns and listened to them, what was holding them back, and then educated them about what had happened, what was happening, and what the plan going forward was. And also you made sure that you communicated all of this with the other staff who was in charge of taking care of the patient, for example, any nurses or any other medical professionals. So the messaging to the patient stays consistent, and it's not that one person is saying one thing and another person is saying another thing. And then after all of this communication, you modified the sessions to take it slowly and also maybe set short-term goals. And as the patient achieved those steps, then they gained more confidence, and then they were able to progress and mobilize further. Also, making sure that you are aware of the analgesia the patient is taking, and making sure that the pains are within the limits of that analgesia, like what it can cover, and also involve the family for more reassurance. And you can later reflect on how psychological barriers can be as limiting as physical ones, and this is something that you always screen for in patients. Question number 2. Describe a time you had to escalate a patient concern. For a question like this, the panelist is looking for how well are you able to identify red flags, how you respond to the red flag, who and how do you escalate the condition to, how do you document it, and how do you ensure that the patient is safe in that moment. A very simple answer for this can be you seeing a patient post TKR and how the pain was quite disproportionate, as well as the patient had some swelling and complained of some tachycardia. And although these observations were quite borderline, you were still quite concerned. So you informed the nurse on the case and also informed the orthopedic registrar, as well as you documented everything that you saw and what you did, as well as you withheld mobilization. And this shows that it's not about you just kind of getting the job done. Your main or first priority is patient safety. And you can add that later the patient was diagnosed with a post-op complication, thereby reinforcing the importance of identifying red flags early and escalating them. More values-based questions can be around the values of the trust or the company that you're applying to. So always check what the values of that company are. For example, if one of the values is caring, the question will not always be very direct, straightforward, like what is caring. It can be disguised as a clinical question as well. For example, they can ask you, give us an example of a time you delivered excellent patient care. Now let's move on to the clinical questions. A very common question in Band 6 TNO interview is, how would you assess and manage a post-operative neck or femur fracture patient day 1? Your answer should start with what is the priority on day 1, and that is patient safety, pain control, and mobilization within medical and surgical parameters. Like I said before, whenever dealing with the patient scenario, always start with your introduction, confirming the right patient, and then taking consent before touching and sanitizing before and after. So you can start with having a subjective assessment with the patient, getting the information, how they're feeling, etc., etc., and then moving on to the objective assessment of the patient, and then concluding with a plan, and then what are you going to do for treatment on the day. So a rough summary of this would include what type of surgery it was it a hemi, a DHS, or an IM nail, and then what is the weight-bearing status of the patient, their pain, cognition, any delirium risk, what are the hemodynamics looking like, and then obviously their past medical history and what was their mobility before the surgery and what are the goals after it. Your management is going to include any bed exercises if needed initially, sitting, transfer practice, and early gait re-education, the selection of any walking aid as needed, if you need to liaise with the nurse or the surgeon regarding analgesics, and fall prevention and discharge planning from day 1. Along with this, it is really important to mention that you're going to constantly reassess and adjust your plan as needed and escalate if the patient deteriorates. But remember to make sure that your answer has to be really structured. Go in the order of SOAP assessment, and then if you're going to do any treatment on the day, how are you going to do it? And then also that you are very aware of any risks or red flags that could be associated with the particular condition in question. And lead with a discharged, focused thinking, making sure that you know when the patient is safe to be independent or how you can support them to become independent as early as possible, and making sure that all of this treatment is cost effective for the patient and for the trust. Next clinical question is about red flags. So the question is, what are the red flags to always look for following orthopedic surgery? Now, the question can be generic after any orthopedic surgery, or it can also be specific to a particular surgery, but I'm just going to answer some common red flags that you need to be screening for in almost every orthopedic surgery. So this is going to include a suspected DVT, pulmonary embolism, compartment syndrome, infection that can be deep or superficial, any neurovascular compromise, disproportionate pain after surgery, acute confusion or delirium. And any red flag would prompt immediate cessation of physiotherapy and escalation of patient care. So the next question is, how do you manage a busy trauma ward with competing priorities? So the answer to this is really important for Band 6 because this is where they're checking for your decision-making, autonomy, leadership, and how you are doing your risk assessment for the patient, basically your triage. And the answer is going to be that you're going to prioritize based on is there any red flags in any patient that needs to be escalated, any other clinical risks involved with any patient, surgical timelines, and if there's any discharge potential in a patient. So, for example, between a day 1 neck or femur fracture patient and a medically stable patient that is awaiting you to help them with stairs, you are obviously going to prioritize the day one neck or femur fracture patient. And always communicate your decisions with the team, and always write them down in your notes about what decision you took and why you took it, and when do you plan to reassess it. Some more clinical questions can also be quite condition focused or area focused. For example, the most common areas that can be asked are the shoulder, the hip, the back, and the knee. So I'm going to give you some options of the kind of questions that can be asked for the knee. Number one, a patient is day 5 post TKR and has developed an extensor lag of 20 degrees. What is an extensor lag? Why is it problematic? And how would you manage it? Another question can be, how would you assess and manage a patient who has developed a suspected DVT following their TKR? Now, this question can be presented as it is, or it can also be presented as a 65-year-old female presents to the emergency department with a 3-day history of swelling, redness, and pain in her left calf. She reports that the swelling has progressively worsened and now experiences pain when walking. She has a history of hypertension and recently underwent knee replacement surgery 6 weeks ago. On examination, her left calf is swollen and tender to palpate with a positive Hoffman signs. Her vitals are stable. What are your differential diagnoses, and what initial diagnostic tests and management steps would you undertake to confirm and treat this condition? Now, both these questions are about DVT. It's just a matter of how they would present it. They can either just say, okay, this person has DVT and how are you going to manage it? Or give you a scenario with the signs and symptoms of DVT and ask what your differentials are and how are you going to manage it. Now, for the assessment and management, I'm going to leave it up to you because this video is going to be too long. But for the differentials, you can say DVT, cellulitis, venous insufficiency, Baker's cyst, superficial thrombophlebitis, any muscle strain or tear. And you should also know why patients post-TKR are at a high risk of this and what are the classic signs and symptoms that they would present with. Another question for the knee in trauma and orthopedic interview can be about ACL. What is the latest evidence for physiotherapy treatment for an ACL repair? Now, there are a lot of protocols for ACL repair physiotherapy. Different people follow different protocols, but the latest protocol that has been gaining a lot of attention and has a lot of evidence is the cross bracing protocol. It is a highly structured multi-stage process which takes you from your surgery to return to activity, and I will let you read that in your own time. Similarly, I will now give you some questions related to the hip, starting with question number 1. You're working with an elderly patient who has recently undergone hip replacement surgery. They're experiencing difficulty with mobility and are hesitant to engage in rehabilitation exercises due to fear of falling. How would you approach this situation to encourage their participation and ensure their safety? Another question can be about red flags. For example, give me a list of red flags that you will look out for in a post-total hip replacement patient. And lastly, a 68-year-old sedentary patient has presented with sudden onset shortness of breath and chest pain 3 days post neck or femur fracture repair. What are your differential diagnosis and management options? I hope this has given you a good idea of the type of clinical questions that can be asked for a band 6 trauma and orthopedic interview. And next, I want to share some leadership questions that can also be asked for this interview. So 2 sample questions are, number 1, how do you contribute to the multidisciplinary team as a band 6 physiotherapist? Number 2, how do you support band 5s or students that come into your hospital? This concludes the sample questions that I wanted to share with you today regarding the band 6 trauma and orthopedic interview. And my final tips are that always structure your interview. Always think about safety, function, and discharge. Whatever you're saying that you're going to be doing, always reason why you've decided to do that. Be confident in your decisions, but do not be arrogant, and show your insight into limitations as well. Because we're not hiring perfection, we're hiring safe clinicians who are reflective and can learn and grow. I hope you found this video helpful. If you have any questions or comments, please drop them in comments below. Otherwise, please subscribe to our channel. And if you want to book any one-to-one consultation, you can do so on our website or drop us an email at info@physique.online. See you next time.